So you're into peptides, you're a little confused about what you're gonna do when you have some joint pain or you wanna boost your recovery. Which, am I supposed to do BPC, CJC? Am I supposed to do TB4, TB500? What is the deal? How do I do it? Who do I talk to? So I'm here to give you some advice in terms of what you can do, how you want to be managing this, what you need, what your thought process is to kind of optimize your care, optimize which peptides you should be using and when and for what condition. So here we go. So in terms of specifically trying to help yourself recover from an injury, we'll go there first. There are probably about 4 peptides, or actually probably 5 peptides that you want to be looking into here to help optimize. If it's a mild injury, you can start with 1 peptide. If it's something that is not serious, you can do it as an injection in the abdomen. And I would recommend either starting with a BPC 157 or TB500. Thymosin beta-4 is very hard to find right now and not really available. I recommend doing them as an injection. You would want to start it at pretty moderate dose and start with 1. The other ones that we could talk about adding in later are either GHK, which is a really great for tendons. You can add in the growth hormone peptides like a CJC. Those are nice add-ons. You can also look into something called KPV, which is, again, better probably for a larger joint if we're gonna do a larger joint injection. And then Pitocin, which is great for treatment if it's a arthritis type condition or a joint condition specifically. So again, if you're having, just in terms of dealing with a little bit of boosting recovery and a smaller injury, definitely look at either doing BBC or TB500 first. Discuss the dosing with your doctor. It depends on what brands that you're using. I always recommend using reputable brands from a compounding pharmacy. If you find a pharmacy that has certain peptides for a half or a quarter of the price that everybody else has it, usually something may be up, but again, you always want to do your due diligence to find that out. If you're dealing with a moderate or severe or an acute injury, either a fall or a partial tear or some specific trauma to a local area, that is where you want to probably be doing a combination of 2 of those peptides. Again, I'd always recommend starting with TB500 and BPC. You want to talk to your doctor about this. You can do it in the abdomen as a starting point. You also can have the doctor inject that into that local area, either as a trigger point if it's muscular, into your shoulder, into the rotator cuff. If it's under ultrasound, some doctors will even do it into the spinal area. Again, you want to make sure that they're accomplished and they have done numerous cases before that. That is the appropriate treatment. If it's something that's moderate or like in a really moderate acute injury, then you do want to usually double up. The peptides are usually going to work better in tandem than they are separately. You also want to limit your costs and how many things you're exposed to, because you can only do these peptides for a certain amount of time. I usually recommend doing these no more than 3 to 4 months at a time. Some will have patients cycle them, meaning that you kind of go alternate from one to the other, or just have a gap where you're not doing any of them. You don't want to just throw everything in the kitchen sink at it at one time, then you're gonna have nothing left if it's a prolonged injury time where you want to have a prolonged recovery. So that's the place that we want to start here. Start with 1, acute injury, start with 2. If you're having surgery or having a severe injury, that is when you may want to do what they call the Wolverine stack, and that is BPC 157 at a moderate dose, TB500 at a moderate dose, and adding in a growth hormone peptide like a CJC or Somorelin. That is something you always want to make sure that your surgeon is on board with. They may be doing other things that may either counteract it, or they may not want it involved to initially affect healing. Some orthopedists and surgeons are very versed in peptides, and some have absolutely no idea what they are and don't want you doing them. That window where I recommend not doing them is anywhere from 2 to 6 weeks, depending on what that surgeon's opinion is. If you're having surgery and the surgeon's on board, or you have a pretty severe acute injury, we usually are going to have you do all 3. The TB500 and the BPC can eventually be mixed in the same syringe. CJC, or the growth hormone peptide, should always be separate. And the CJC or the growth hormone peptide should be given at night, 90 minutes after eating, while I normally recommend doing the BPC and or the TB500 during the day. That's sometimes you can even do BBC twice a day if necessary to really achieve that high dose. Also, those medications can be injected into that local area if you had surgery, and again, okay with the surgeon, or it could be if it's a trigger point, a muscle or a tendinitis, all those things can be helpful. So that is the starting point in terms of making sure they're on the right protocol for pain and or recovery. I mentioned briefly, if you have a condition with arthritis, be it the knee, be it the shoulder, then that's when we're talking about something called Pitocin, which can be mixed with hyaluronic acid, which is that like really thick jelly-like substance, and we can inject it right into the joint. We can also use higher dose BPC as medicine for the arthritis. We're not going to be using the dose that you do into the abdomen. We're going to go much higher dose for arthritis, and that's something that's how we normally would do it. KBV is also could be very helpful as well. We do KBV or BPC, usually with the Pentosan. So that's in a case if we're trying to treat arthritis. And again, these are going to be more where we're going to load you up on the higher dose peptide and then may have you do the abdominal injection and other things throughout the period of time that you do have the condition. Hopefully it's mild and it could be improved. If not, again, this could be a prolonged, and we were going to cycle through different peptides and different other treatments. We're learning now with arthritis, it's not just repairing the joint. We want to do things to help improve the mitochondrial health, and we know mitochondrial dysfunction can lead to pain. So we may add something like a MOTS-C. If this is something that's moderate or severe, we also want to, we know there could be some nerve issues, so we may use either cerebrolysine or ARA290 or other peptides as well. Arthritis becomes a much more complicated issue because it's usually going to be something that we're going to be dealing with long term. It's not something that's going to be an acute injury, a rotator cuff sprain, or an ankle sprain or something like that where we can just treat it and then you're done. We are also now using, we know there's also a relationship with autophagy, which is the body's ability to recycle the cell. And we're now adding high-dose spermidine, which is derived from wheat germ, to help with the inflammation, and using that in conjunction with the peptides and other physical therapy and other types of treatments. And there's plenty of other treatments out there that we know that have been shown to potentially help. We know there's been some connection between arthritis and pain and what's called senescence, which are zombie cells or cells that have died and not been cleared by the body. And that can be addressed through numerous different products that are out there. TA65, quercetin, ficillin, growth hormone peptide injections may help improve senescence. The MOTS-C may improve senescence. So there's different ways that we can help address arthritis conditions. I want to morph really quickly here. So that's how we deal with injuries. There's different combinations, but usually we pull out the Pentosan or the KBV more for arthritis, or we'll do high dose BPC. We don't use as much TB4 or TB500. We're gonna talk now about recovery and tendinitis, which is where GHK is really great with. GHK is a copper peptide that's naturally in your body. It helps with skin and collagen building, and it's naturally present in your body. And this is done either through, if we're treating tendinitis, we're gonna inject locally into the area. You will do it systemically through doing intra-abdominal injections. They do make really great pain creams that either by GHK cream by itself or with BPC or with BPC and KPV if it's a local, very superficial area of pain. That's the other peptide that we tend to use a lot of. And also use GHK for recovery. In terms of recovery, if you're having problems recovering from a hard workout or your hard workouts, not just a one-time thing, that is where we would fall into more of BPC or TB4 first, or when I say TB4 now, I mean TB500. The TB4 or TB500 works on the actin, which is part of the muscle, which helps the muscle grow and helps with your recovery and decrease the inflammation. BPC, which is body protective compound, also can help by increasing the amount of growth hormone receptors and other decreasing anti-inflammatory chemicals in the body, can help with recovery and muscle growth. You do want to combine that with things like your creatine and beta-alanine and other parts of your whole workout routine. I hope this answered a lot of your questions in terms of how you're going to use peptides for injury and recovery. Feel free to put any comments below and follow this channel for great information on peptides, health optimization, biohacking, and more.